This video is going to cover a pharmaceutical scandal that involves mysterious drug origins, unusual patent histories, inadequate clinical trials, deceptive marketing slogans, and even a connection to the Nuremberg trials. It involves a smearing of whistleblowing doctors, multiple lawsuits, and profiteering industry participants who deny wrongdoing even when caught red-handed. Companies that remain in business despite knowingly causing deaths and injuries in the thousands. History does not repeat itself, but it rhymes. I think it's a fitting quote for the video, and we'll see how innocent people get caught up in the lies of others and ultimately are the ones who pay the price. The faces may change, but unfortunately many of the themes remain the same. Thalidomide went to market in 1957 as a sedative drug and was used in the treatment of anxiety, insomnia, and nausea in pregnant women. In fact, it was first released in West Germany under the name Contigan, where it was available for purchase over the counter. It was heavily promoted by Chemie Grünenthal, which is still in business today under the name Grünenthal. Today, the company produces the big-selling analgesic Tramadol, as well as the birth control pill Belara. Thalidomide was said to be the invention of the infamous Nazi doctor Heinrich Muchter in the 1950s, although later we'll see that the drug was probably a rebranded byproduct from Nazi pharmaceutical programs. As stated by the Alliance for Human Research Protection, after World War II, Nazi scientists stared down their pasts and searched for career opportunities. They gravitated toward fiercely competitive industries whose operations were shrouded in secrecy. One such hospitable industry was pharmaceuticals. They were able to channel their criminally acquired expertise to the development of drugs. Another example was Nazi eugenicist Martin Stemmler, who also found work at Chemie Grünenthal, but probably the most notorious member of the firm was Nazi chemist Otto Ambros. He was convicted of crimes against humanity at the Nuremberg trials, but was released early in 1951 and became chairman of the advisory board of Chemie Grünenthal. Patents were taken out on thalidomide in 1954, and after a few experiments with rodents, which were apparently calmed by the drug, it was declared fit for human use. The patent application strangely mentions that the drug had already been tested on humans, the significance of which may become apparent later. Promotional material was already being prepared in 1956, and it went out to the public the following year. It was never officially tested for safety in pregnant women, and Chemie Grünenthal's marketing campaign included sending out millions of free samples to doctors and hospitals around the world. To add to the confusion, it was distributed with 37 different brand names. The first public problem was actually seen in 1956 when Chemie Grünenthal employees were given free samples of the drug. Later that year, the daughter of one of the company workers was born with no ears, although nobody made the connection to the drug at that time. However, by 1961, Hamburg pediatrician Wedekind Lenz reported a large increase in the number of infants with phocomelia attending 10 clinics in North Germany. Phocomelia is a rare congenital deformity in which the hands or feet are attached close to the trunk, so the limbs are grossly underdeveloped or absent. There can also be abnormalities to the face and other areas of the body. In West Germany, there were approximately 2,500 babies severely affected by thalidomide. East Germany at the time, under the communist Iron Curtain, was essentially unaffected, as the drug never really made it into the country. Somewhat ironically, it seems that the power of Big Pharma met its match in the Central Advisory Committee for Drug Traffic in the GDR. The communist authorities also couldn't see the need for a new sedative when powerful sedatives such as barbiturates were already available. I guess they thought that if you were going to distribute dangerous pharmaceuticals to the masses, better not confuse them with too many options like those crazy capitalists. In the United Kingdom, there were around 2,000 thalidomide babies, half of which died within a few months. The drug was withdrawn there in 1961. In Canada, the drug continued to be available in pharmacies until 1962. In December 1961, there was an admission by companies supplying the drug that there had been reports from abroad on the occurrence of congenital malformations in the offspring of a few mothers who had taken thalidomide early in their pregnancies. In March 1962, the drug was withdrawn from the Canadian market, although it wasn't until 4 months later that the authorities sought to advise doctors that all patients who had supplies of the drug should be contacted to destroy any remaining pills. A 1963 special report on the Canadian situation advised with regards to detecting potential adverse effects of pharmaceuticals. Practicing physicians must be assiduous in reporting these to appropriate agencies collecting such information. Unfortunately, even today we see only a minority of cases being reported to drug and vaccine monitoring systems, often suspected to be well under 10%. The United States was minimally affected by thalidomide because the FDA refused to approve it, saying further studies were necessary. Yes, you heard that correctly. The FDA were looking out for the people on that occasion. However, there was still a small number of thalidomide babies due to the free samples that were being distributed across the country. So how was it that thalidomide was recklessly given to so many unsuspecting pregnant women? Some of the marketing campaigns would probably shock you, although then again, maybe not. In the UK, Australia and New Zealand, thalidomide was marketed as Distaval. Advertisements such as this one informed the public of the remarkable safety and effectiveness of the product, as well as suggesting that it would even be of no concern if the toddler in the photograph helped itself to mum's supply. And this advertisement appeared in the British Medical Journal in 1960 with the safe and effective marketing slogan that is probably familiar to most of you now.
I also need to be a role model and just demonstrate that it's safe, that it's effective.
The ad makes the disingenuous claim that no severe toxic effects of any kind have ever been reported. It is also interesting that a message of fear is used in the marketing. In this case, fear of death from using barbiturates instead. Wouldn't it make more sense to just ignore these big pharma narratives and not use any pharmaceutical products? There is also a disturbing story regarding what happened to the initial thalidomide whistleblower. In November 1961, Dr. Lenz attended a Pediatricians Association meeting where the noticeable increase in birth defects were being discussed. Lenz stated publicly for the first time that a certain substance recently introduced in the West German market was responsible for the current epidemic. Before the meeting ended, most of the physicians in attendance knew that thalidomide was the drug Lenz had referred to. Because there was no social media in that day to smear Dr. Lenz, 3 Grenenthal representatives, including the company's legal advisor, came to see Lenz in person the following day. Grenenthal threatened to take legal action against the doctor for a claimed unjustified attack on their company. But the health authorities were alarmed and asked Grenenthal to voluntarily withdraw the drug from the market. Instead, the company sent out almost 10,000 promotional leaflets to doctors across Germany that declared Contagion is a safe drug. Grenenthal then launched a withering barrage of personal attacks on Lenz. The company's executives slandered Lenz's family publicly, stating that his father was a famous and popular geneticist in Nazi times, since he had proven the validity of the master race concept on genetic grounds, which seems ironic given that the firm employed Nazi war criminals. But that was just the beginning, and the company began a siege on Lenz's integrity that lasted 10 years. But Lenz stood his ground and spent a large part of his professional career testifying on behalf of thalidomide-damaged children. He felt a personal responsibility toward the victims, many of whom he continued to visit for years afterwards. In one court case, Lenz was cross-examined by 18 Grenenthal lawyers over a period of 12 days, but was said to remain calm and unfaltering. At one point, the defence suggested that surely it was possible for the defects to have been caused by some unidentified, wait for this, virus. Because there had been no cases in East Germany, the paediatrician simply replied that a virus would not stop at the Berlin Wall. This response baffled the defence attorneys, who probably wished they had never mentioned it. However, as outlined in Peter Gottschalk's Deadly Medicines and Organised Crime, the immense power of Big Pharma perverted the course of justice. In the US, for instance, the company that distributed thalidomide simply hired every expert there was on birth defects to prevent them from testifying for the victims. In Germany, the company's lawyers argued that it wasn't against the law to damage a fetus because fetuses had no legal rights in that country. There was a ridiculously small settlement of about $11,000 for each deformed baby, but no personal responsibility was ever assigned and no one served any prison time. It was no different in the UK, where nobody was found guilty or was even charged with a crime. Gottschalk continues, the United Kingdom behaved like a dictatorship state. The journalists weren't allowed to write about the court cases, and people at the highest positions in the country, including the Prime Minister, were more interested in defending the company and its shareholders than in helping the victims. It took 16 years before the incriminating evidence that had been described in an article the Sunday Times was forbidden to print finally came to public knowledge. Gottschalk's next comment may come as a surprise to you, but remember he wrote this in 2013. It is difficult to understand that the UK censorship happened in a European country. On this theme, in 2018, Gottschalk himself was forced out of the once venerable Cochrane collaboration, the organisation he co-founded. His best-selling books exposing Big Pharma were welcomed by the public, but not by the Cochrane leadership, which denounced them publicly. As Gottschalk stated, Cochrane's CEO, Mark Wilson, has introduced scientific censorship. At the same time, the Cochrane collaboration published a favourable review of HPV vaccination. Gottschalk had been increasingly warning the public about the dangerous influence that the pharmaceutical companies have with vaccines as well. So he published a counter-article titled, "The Cochrane HPV Vaccine Review was incomplete and ignored important evidence of bias." As he pointed out in this paper, most of the 14 Cochrane authors on the first published protocol for the Cochrane Review had major conflicts of interest related to the HPV vaccine manufacturers, and all included trials were funded by the HPV vaccine manufacturers, and the meta-regression was meaningless. For a more fundamental assessment of the suspect virological claims surrounding HPV and the plausibility of the HPV vaccine, we address this in detail in Chapter 8 of Virus Mania. Back to the thalidomide story, the Grünenthal Group finally made a public apology in 2012, saying in a statement that it regretted the consequences of the drug. Martin Johnson, director of Britain's Thalidomide Trust, responded that the company was still trying to perpetuate the myth that no one could have known of the harm the drug could cause, when there was, he said, much evidence that they did know. Indeed, thalidomide victim and researcher Rosaline Moriarty-Simmons reported that documents from 1944 referred to Contigan, one of many names attributable to thalidomide, as being tested on female prisoners of war at the Auschwitz concentration camp by doctors Heinrich Muchter and Otto Ambros. Further, there was a memo later that year explaining that a drug numbered 4589 with the same chemical formula as thalidomide had been tested and was ready for use. Moriarty-Simmons also noted that in 1955, just prior to marketing, 3 physicians took part in a symposium arranged by Chemie Grünenthal, at which they reported unsatisfactory experiences with thalidomide. However, these reports were ignored, as was the warning by a German neurologist in 1959 that thalidomide damages the central nervous system. That kind of information didn't fit with the safe and effective marketing campaign being pushed by the company. Additionally, it was reported in 2011 that a lawsuit had been filed in Pennsylvania alleging that GlaxoSmithKline, predecessor SmithKline in French, had been approached by Chemie Grünenthal to distribute the drug in the US and concealed from the public that it tested thalidomide on at least 875 people, including pregnant women, in the 1950s. After completion of the trial, SKF declined to commercialise the drug, possibly due to knowledge of the damaging effects, but the unsuspecting public remained unaware of what had taken place. So, did the world become a better place after the sordid history of the thalidomide scandal was exposed? There were certainly improvements in clinical trial requirements, particularly surrounding protection of unborn babies. However, as outlined by authors such as Peter Koche, industry players have found new ways to circumvent the system, and dangerous products continue to hit the market in the current era. Additionally, some pharmaceutical classes do not require the same degree of testing or can be given emergency authorization before long-term effects are known. Often in these circumstances, the drug manufacturers receive billions of dollars of taxpayers' money for these experimental products, while governments grant them indemnity from damages, including deaths. I found something that physician Dr. Judy Stone had written in 2012. Despite the Nuremberg trials and the development of ethical principles to guide research, we haven't yet gotten it. We seem to be confronted almost daily by evidence of our mistakes. What more will it take for us to learn and put people and ethics above power and profits? The good news is that many people are awake to the game and know that in most cases, pharmaceutical products are not the path to health. In fact, it's highly unlikely that many of you are suffering from a pharmaceutical deficiency. So let's keep our divine bodies chemical free whenever we can. To help sustain my channel in this time of censorship, please support my work on Subscribestar. Link is in the description.